Hi, my name is Dr. Jeff McNairy. I'm the Chief Medical Officer at Rythmia Life Advancement Center in Costa Rica. I have a doctorate in psychology and a master's degree in public health. So, who should try ayahuasca? Who is it good for? Well, it's good for a lot of people, and the reason is because a lot of us in a modern society have a lot of depression and anxiety, and we have trauma history. We're dealing with a lot of mental health issues in the West and in the world, not just the West. So I have found in the 16,000 patients that we've worked with here at Rythmia that everyone pretty much has a couple things in common. They're trying to find out who they are, what's holding them back in life from being happy, and they're trying to get on the right path so they can have the most level of success and spend quality time with their families and have a life purpose. And so I believe that ayahuasca, if it's medically appropriate for the individual, is for everybody. Now, there are some people that should not participate in ayahuasca sessions, and the reason is because there are certain medications, and there are certain mental health diagnoses, and certain heart conditions and things that are contraindicated with ayahuasca. Just basic, kind of briefly, some of those are if they've had open heart surgery, if they have an arrhythmia, if they have stents in their heart or pacemakers, those are things that are contraindicated. If they're on certain medication, especially selective serotonin reuptake inhibitors, which are SSRIs for depression, they have to be off of those for about 30 days. Other psychotropic medication like benzodiazepines, all of the stimulants for ADHD diagnoses, and also pain medication are contraindicated with ayahuasca. So it's always important to consult with your prescribing physician to be able to come off of those meds if recommended. Now, some people should not come off those meds for various reasons that you should discuss with your healthcare provider. But what I've seen is that ayahuasca really helps people, especially veterans in the military, overcome the trauma that they went through in the battlegrounds. Now, a lot of us didn't go through the military. We're not veterans, but we've had our own trauma, our own wars that we fought in our childhood or in our recent years. And it's really, really helpful to overcome some of those issues. And the way it works, the big question is, how does ayahuasca help with trauma or help with any of these mental health issues? The reason it works, and the studies being conducted right now show that when someone drinks ayahuasca, there is a concept called epigenetics that looks at the way that your DNA is being adjusted for with certain receptors in the way it's being expressed in your genome. And so there is something called a sigma-1 component, which is a receptor that allows for the synaptic plasticity of your brain, which means the moldable, changeable components of your brain to be adjusted during trauma events, and help bring forward the emotions and the memories that you've held in the amygdala region of the brain to block certain emotions that were hard during abuse and during trauma for survival. So that's a lot of words to explain that your brain is adjusting in a positive manner to really get on a new pathway and adjust the way you think about yourself and the way you think about your environment. Because when you're caught in a rumination rut of whether it's trauma or depression or other things, that the default mode network of your brain in its resting state sort of loops and constantly views you in a certain way, and you view yourself in the way you view the world, you can overcome the negativity that you've been locked into through conditioning, through life experience, through painful, traumatic moments, and you can break free of that through this process of intention setting and mindfulness that's facilitated by the ayahuasca session.